All right. Wonderful. Well, welcome to disaster preparedness for the LGBTQ community. This is the second of a two-part webinar series. I think many of you were able to join us last week, and if you hadn't, we'll be introducing you to our subject matter expert, Leighton Jones. I wanted to introduce myself and my colleague first. My name is Caitlin Hauk. I'm the Executive Director for the Maryland National Capital Home Care Association. And I also serve as the Executive Director for the Maryland Emergency Preparedness Network. And our Associate Director for the Maryland EPN is Sharmetta McCready, who is going to be our behind the scenes support today. Just a little bit of housekeeping. We will have the presentation recording and resources in addition to the two topic fact sheets posted on the Maryland EPN website, so that you are welcome to refer to those after the presentation is complete, but also please feel free to pass it on to your professional network so that others can access it as well. The Maryland National Capital Home Care Association, if you're not already familiar, is the trade association for the home care sector here in the state of Maryland. We also support DC, District of Columbia providers as well. So our association is made up of members from Medicare certified home health agencies and residential service agencies. So those are the private duty agencies and also durable medical equipment providers. So we have a very broad network of folks that we support. And if you are not already a member, of course, I'd welcome a conversation with you and tell you all the resources and information that we can provide to you through MINCA. MINCA is very fortunate to operate the Maryland Emergency Preparedness Network through our partnership with the Maryland Department of Health Office of Preparedness and Response. And so it's through the OP&R grant resources that we're able to make the Emergency Preparedness Network toolkit, resources, and the resource guide available to you. So if you haven't done a deep dive onto our website, please do. There's just a host of resources there. Last year, we had a lot of opportunities to provide COVID-related resources. So wonderful resources there. And to this season's topic presentations geared towards LGBTQ community are meant to help bolster those resources as community-based providers consider how to best support vulnerable populations. So with that, I want to go ahead and introduce our speaker for today. Leighton joined us last week. So Leighton Jones is currently the Director of Emergency Response for Direct Relief, which is an international humanitarian organization that's based in Santa Barbara. Prior to joining Direct Relief, Leighton led the Emergency Preparedness Research, Evaluation, and Practice Program at the Harvard T.H. Chan School of Public Health in Boston. Prior to that, he worked as the Chief Program Officer for the American Red Cross of Massachusetts and had various positions in the American Red Cross and also the Salvation Army in New York. He does have direct experience with being deployed in response to numerous disasters that have occurred across the United States, hurricanes, tornadoes, floods, fires, and aviation disasters. So he brings a wealth of knowledge and experience, and we're so very grateful that he is leading this conversation. Leighton did serve at Ground Zero in Manhattan following the September 11th attacks, and also led the Red Cross response to the 2013 Boston Marathon bombings. He is a graduate of the University of Plymouth in the UK and Harvard University. He's a certified emergency manager with the International Association of Emergency Managers and conducts trainings both nationally on diversity, equity, and inclusion in emergency planning and response. So Leighton, without further ado, I will go ahead and turn the presentation over to you. As we go through the presentation, you'll see different resources and including a survey link that are going to pop up in the chat, but please feel free to use the chat and we can address your questions as we go along. Leighton, thank you.
Thank you. Appreciate it. Thank you very much. And I just realized I think I have the wrong presentation here. Hold on. Oh, easy. Yeah, this is the wrong presentation. Hold on, everyone.
Those are the hazards of a back-to-back two-part webinar
right?
series.
Last week's. For those of you who didn't tune in last week, you now have a preview. Hold that thought. Hold on a second.
Leighton, while you're pulling that up, just want to make sure that folks are aware, within the next week, we will have both the presentations, the video recordings available on the website. You might not see them by the end of this week, but within the course of the next week, you will be able to see them. So I just want to make folks aware that it'll take us a minute to get it up, but it will be there. And you're welcome to email us at the info at mdemergencyprepnetwork.org if you have any questions.
Thank you, Caitlin. Good time filling there. That was good. So I apologize for that snafu. We're at the right presentation now. So good morning. Thank you all for joining us. Thanks for that introduction, Caitlin. I should add, Caitlin didn't want to out me, but I am a cisgender gay man. My pronouns are he, him. So we want to get started this morning. I just want to kind of go briefly over what we're going to talk about this morning and how we're going to structure the webinar this morning. We're going to talk about some general preparedness points, right? So I think, as you'll see as we go through this webinar, the majority of individual preparedness points for the LGBT community are shared by everybody in the community. They're not specifically LGBTQ. But we're going to go over some of those, and then we're going to mention each section kind of some of the specific considerations that LGBTQ plus people should consider in their particular disaster plan for themselves and their household. So know that kind of we're going to cover some of the basic everybody preparedness points, but then we're going to look specifically at some very specific considerations for this community. So we're going to go through, for those of you who are familiar with disaster preparedness, we're going to go through the basic tenets of get informed, make a plan, build a kit, and then maintain your plan and kit. And then we're going to briefly, towards the end, look at during and after a disaster, some considerations for the LGBTQ community, how to get involved in your local community disaster preparedness in your local community, and then we're going to share some resources with you. So that's the structure that we have today. You'll see that little logo there with the rainbow kind of shadow. You'll see that logo when we're talking about LGBTQ plus specific preparedness considerations for the community. So I know when you see that, that's when we're going to talk about specific community considerations. So let's level set. What is disaster preparedness? Disaster preparedness consists of a set of measures undertaken to better respond and cope with the immediate aftermath of a disaster, whether it be human-made or caused by natural disasters. So these are measures that are taken by government, by business, by nonprofits, and by individuals. So today we're talking about individuals. If you tuned in last week, you know that we talked about some of the considerations that disaster planners, disaster responders, and community organizations should take into account when trying to plan inclusively for and with the LGBTQ plus community. Today, we're talking about individual steps that individual members of the LGBTQ plus community can take in their personal and household disaster preparedness. So if you didn't tune in last week, as Caitlin said, it will be up on the website soon. I encourage you to watch that too, if you're in the role of serving the community in any way, either as a responder, a planner, or a community organization. But today, we're talking specifically the disaster preparedness for individuals. And then this is something that I always like to say when I'm talking about disaster preparedness. When we talk about disaster preparedness, it's not presenting a standard set of answers of what everybody should do. It's more about presenting the right questions that each individual needs to ask for themselves and their household. So today, as we go through the webinar, you will see that we're not necessarily giving you hard and fast answers. There will be some of those, but the whole point of today is really to take what we're presenting and then think for yourself in your personal situation, how does this apply to me? What do I need to do? What are the things and the processes and the items that I need to get ready so that I am better prepared if a disaster impacts me in my household? So know that it's more about asking the right questions. So today there's a lot of questions. They're not even questions that we can answer for you. They're questions that you need to ask yourself and answer yourself. So a little bit of an approach here. FEMA introduced this approach about a little over a decade ago now, that is called whole community disaster planning. And it's this concept that when a disaster happens, we shouldn't just sit around and wait for the federal government to come in and save us, or for that matter, anybody to come in and save us. Whole community disaster planning is this concept that everybody in the community has a responsibility and a role in disaster planning and disaster response. And so it's not just government, it's not just community organizations, it's also individuals, and it's also community leaders and community groups. So we're collectively making this commitment to be more prepared as a community at every level. So that's kind of FEMA's approach. I think it's a really good approach. You know, we're all responsible for our own preparedness, both personally and collectively as a community. So why should we be prepared? So we should be prepared because after a disaster, emergency resources may be limited, and they're almost certainly going to be delayed in getting to you. When a finite number of emergency resources is available to a whole community that's been impacted by a disaster, there are going to be limits and there are going to be delays. And so being personally prepared helps you manage that delay. You know, in non-disaster times, we're used to calling 911 and having an ambulance or a police or a fire truck arrive at our house within a few minutes. During a disaster, that's not going to be necessarily the dynamic. So we need to be personally prepared so we can go about protecting ourselves and our households. It's about health and safety, right? Being prepared for a disaster, and not to be overly dramatic, could possibly save your life. It definitely will make you a healthier person, both physically and mentally during a disaster, and you'll come out the other side of the disaster being more resilient and healthier than you were if you had not been prepared. It also definitely reduces stress. I don't think I need to explain that for you. When you're more prepared for anything, I'm more prepared for this webinar. If I had just shown up this morning and decided, oh, what am I going to say? I'd be stressed. I'd prepared for this webinar. So it definitely reduces stress if you're prepared for any disaster that might come into your community or into your neighborhood. Why else should you be prepared? Because it enables you to be able to care for your neighbors and your community. And this is going to be an ongoing theme throughout this webinar. Disaster response is, even though we're talking about personal preparedness today, it's much more than that. It's about caring for your neighbors. And time again, during a disaster, we see communities come together. We see neighbors helping neighbors. Often neighbors who've never spoken to each other now are in a position where they're really supporting each other through a disaster response and recovery. So if you're more prepared for a disaster, you're more able to care for your neighbors in your community, which is something I believe we should all be striving for. So these are the preparedness steps, and we're going to take each of one of these in turn, and you'll see these logos in the corner of the screen as we kind of go through this process. Sometimes you'll see disaster preparedness change the order of these. This is the order that just me personally, I like to put them. I think being informed is the first step, so I put that first, but sometimes people make a plan before that. Doesn't really matter, as long as you do them all. It doesn't matter what order you present them in. But we're going to talk about getting informed, making a plan, building a kit, and then maintaining that kit and that plan so that it's always ready when you need it, when a disaster happens. Hopefully you will never need it, but you're ready if it does. And then I just wanted to point out here, this kind of goes along with the fact that we're really more about asking questions today rather than giving answers. You also need to think about your specific individual needs. Like maybe you have a disability, or maybe you have a health issue, or maybe you have a child with special needs. All of those need to be considered as you plan for your disaster preparedness plan and your kit. So let's talk first about getting informed. So this is kind of the first step. The first step you need to do is kind of look at your community, look at your neighborhood, look at your town or your city that you live in, and know what particular disaster hazards might happen to your community, right? So for instance, if you live in Maryland, you're unlikely to suffer from a from a earthquake, for instance. I hesitate to say that because it's possible, but doing that assessment of your community hazards, like what are the most likely hazards that are going to impact your community? Is it flooding? Is it hurricanes? Is it a fire, either a wildfire or a home fire? Is it winter storms? Is it heat wave? Is it tornado? So think about these hazards that might impact your community. In the disaster planning world, we actually have a matrix where we look at the likelihood of something going to happen in your neighborhood. And then if it does happen, how big of an impact will it make? So even though, for instance, a tornado might be low on the likelihood of happening in your neighborhood, if it does happen, the impact will be high. So balancing those two things out in an equation of what your hazard kind of matrix is a really good kind of thought process to go through, and it will inform everything that we're going to talk about for the rest of the webinar. What you need to do in terms of planning, what you need to put in your disaster kit. It will inform all of that. So for instance, if you live in a place that never gets winter storms, I know Maryland is not one of those places. Southern California, where I live right now, is there's a low likelihood that people in Southern California have to prepare for winter storms, right? But earthquakes are higher on that list, right? So everybody has a different portfolio of hazards that they need to prepare for. So this is the starting point, is doing that assessment of what is your hazard assessment for you as a household, for you as an individual, for your community. And then the other thing, how do you know when a disaster is happening, right? You have to know a disaster is happening or is coming in order for you to put your preparedness actions into play. And so we're all familiar with some of these. That broadcast emergency alert system, that's that annoying tone on your TV that comes on, and then a message will flash across the screen. It also happens on radio. So that's something that exists in every community across America. I would caution you that it doesn't work on streaming television services, for instance. So if you don't have a broadcast TV station that you're watching, if you're watching something on Netflix or Hulu or Apple TV, the emergency broadcast system is not going to happen on those platforms. So it's very useful, but know its limitations. That might be where you get your information from. You should also sign up for local text, phone, and email alerts from your local community. I've included 2 statewide ones here. So Maryland Ready and Alert DC are both, if you're not already signed up for either of those or both of those, you can sign up on their websites and sign up for text, phone, and email alerts. That, in my opinion, is probably one of the better ways to be informed of a disaster. It pushes the alert to you as a text or a phone call or an email when something's happening. I should also add that a lot of counties have a similar service for their county. So look up the county that you live in, see if they have an alert system that will send you a text when something is happening in your local community. I will also say that you don't have to live in a jurisdiction to sign up for those alerts. So if you work in a jurisdiction but live in another, sign up for both. Or if you just want to know maybe what's happening in DC, but you live in Maryland because you're super close, you can sign up for both. You don't have to live in the jurisdiction to sign up for these alerts. So if you do nothing after this webinar and you've not signed up for those, that's a really good action point to sign up for your local text alerts from your local jurisdiction, your local emergency manager. Another thing you can possibly do is follow your local emergency management team on social media, on Facebook or Instagram or Twitter, whatever social media you may have. Many of them have social media accounts that they post similar things to there. It's not quite as push forward as the text alert. You know, you've got to actually go and check their social media in order to read it. But once you know a disaster is happening, often that's the source of more detailed information of what you should do next. So that's also a good thing to do. Follow your local emergency manager and management agency on their social media accounts. And then some communities have a reverse 911 system where if something is happening in your very specific neighborhood, they are able to call all the phones in that neighborhood. Now, this also has some limitations. It's usually just for landlines. There are some systems that work on text cell phone towers too, but that's a little bit more complex and limited. So no, there's a limitation to this too, but that also is a way. You don't have to sign up for that. That will happen to you if something is happening and they activate it in your local community. So All of these are ways to get informed. There may be other ways, following the National Weather Service, for instance, making sure you're listening to weather alerts, signing up for any of those kind of services. So again, look at what's in your local community, about how you can be informed. Who are the agencies in your local community that are pushing out disaster alerts or disaster information once the disaster happened? Maybe that's your local Red Cross. They don't necessarily put out breaking disaster news, but once the disaster happens, they'll be putting out where the shelters are opening and things like that. So being informed and getting informed is really important first step. And then what do you do with this information, right? So you should stay aware, be aware of alerts, watches, and warnings. You should listen to announcements from local emergency management and the National Weather Service and do what they tell you you should be doing. You should listen to them and then do that. And you should know the emergency plan for your area, including any evacuation routes that might exist, any shelters or emergency numbers that you might need. Put them in your phone so you have them ready. That's a really good preparedness step. I should say in most places, this varies from location to location, but in most places, disaster shelters aren't pre-designated places necessarily. They might be pre-designated in that this is a building that might be used for a disaster shelter, but they're not pre-designated to necessarily or automatically open during a disaster. So you will still need to be aware of what shelters are opening and when they're opening. And that will be announced through all these routes that we are talking about now. So there's a little bit of humor here. So there's a lot of confusion about what's the difference between a weather watch and a weather warning. Even sometimes I get confused about this, right? They seem very similar. Like, what's the difference between those two when you see there's a winter storm watch or a winter storm warning? So this cupcake analogy has been going around for a few years, but it works for me. So a cupcake watch is where you have all the ingredients in your kitchen, but you haven't started doing anything about it yet, right? So the ingredients are there, but nothing has happened yet, right? So in a storm situation, that means the atmospheric conditions are in place for a storm to develop, but a storm has not developed yet. But we should watch in case a storm happens, right? So that's a watch. A warning is when it's been mixed, baked, and ready to eat, right? So we are ready to go. The cupcake is ready. The storm is already happening. It's on the ground. That's when you should start taking action. So the watch is be alert, be ready. A warning is now I probably should do something to keep myself and my family safe. So that's be informed. There are other aspects of that. Again, you might be asking now, like, oh well, how do I know what my child's school is going to do during a disaster, for instance, right? So that's an element of being informed, right? Do you know your child's school plan? Do you know my elderly relatives' home care plan or nursing home plan? Like, what are the plans for other members of your family that maybe you won't be with during a disaster, or potentially won't be with? Do you know those plans? So being informed of those plans is also really good. And then make a plan. So there are different kinds of preparedness plans. There's your personal plan, that's your household's plan, what you and your household are going to do if a disaster impacts your home. There's a personal plan at the workplace. What are you going to do if a disaster impacts your office or where you work, your factory or where you work? There's a family plan that includes everyone in your household, including your pets. Your pets are your household. And then there's a community plan. So how many, what are the plans in your community? How are you going to help your neighbors? How are you going to help the community organizations in your town? And your plan you should plan for at least 72 hours of plan. So like some of this is immediate actions, like how are you going to leave your house? How are you going to leave your neighborhood? How are you going to leave your town potentially? But some of that is also longer, like how long can I be away from town? And we'll talk about this when we get into building a kit a little bit more. What do I need to plan for at least 72 hours of being away from my routine, away from my house, away from my home? Know your evacuation routes. And there are different evacuation routes here, right? So practice evacuating your house as a household. Like, do you know how to get out of your house quickly if there is a house fire that's happening in your house? So, and kind of single family house fire level, do you know your evacuation routes from your house? Do you know where you're going to gather outside your house if something's happening and you have to evacuate immediately? Do you know the evacuation routes out of your neighborhood or out of your city? Now, some of these are designated. You'll see the emergency evacuation route there. So some communities have really good emergency evacuation routes, particularly ones kind of close to the coast in a hurricane zone. We have ones here in California for tsunami evacuation routes. So these are posted in some communities, but you also might want to decide on your own. Get out a map, look on Google Maps and say, where's the best place? What's the quickest way? And have more than one evacuation route out of your neighborhood in your city, so that if one is snarled up or closed because of the disaster, you can go a different way or maybe a third way. Create a personal support network. So especially in the LGBTQ community, we know that a lot of LGBTQ folk live on their own, have less of a support network, at least in the traditional sense of that word, than other folk. But a lot of us have chosen families, we have friends, we have neighbors, we have community groups that we connect to. Create that personal support network and make those people part of your disaster plan. So talk about your disaster plan to them. Make sure they have a disaster plan. Include them, include each other in your disaster plan. This is not a standalone kind of process. You can involve other people, you should involve other people. In your plan, you should plan for services to be unavailable, particularly services that rely on the internet or electricity, which we know are often unreliable after a disaster. So one of the things you need to plan for is when you see that weather warning or that weather watch, that's the point where you should make sure all your devices are fully charged. You should pre-charge your devices at any time. So those of us who get worried when we go lower than 10% on our battery life, this is a really good preparedness tip for you. Make sure you're fully charged when a storm watch comes into effect. Inventory your home possessions. A good way of doing this is just walking around your house and videoing everything that you have in your house, so that if for some reason your house is damaged or destroyed, you have evidence of what it looked like before the disaster, what you had before the disaster, and that will help you in disaster recovery and disaster response. So just walk around your house and video your house, and then save that video somewhere on the cloud, somewhere else where it's easily accessible if you don't have access to your phone after a disaster. Same thing with important documents. Make a copy of them. There's a few different ways you can do this. You can make physical copies of them and put those physical copies in your disaster kit. We'll talk about that in a little while. You can take photos of them and store them in the cloud. You can store them on a thumb drive and then keep that thumb drive somewhere else. I would suggest maybe doing all of the above. So you have your important documents in multiple locations. So you have that redundancy in a disaster. And those important documents can be anything you think is important. So things like birth certificates and passports and marriage licenses and adoption papers, anything like that that you might have are really important to keep and have copies of. And then communications. Communications can be one of the most challenging things during a disaster. Consider how you will communicate to your loved ones, especially if the internet or electricity is unavailable. Keep important phone numbers in multiple places, not just on your phone. I know with the advent of cell phones, none of us know any numbers anymore. I don't even know my own number most of the time. So keep them in multiple places, not just on your phone. Like write them down, have a little piece of paper, put that in your disaster kit. Make sure your phone contacts are uploaded to the cloud too, so that you can access them even if your physical phone isn't available. So know that there are many different ways of that. Another good way of doing it, if you use an email service that is on the cloud, like Gmail or something like that, you just send an email to yourself. Title it something that you know you can easily search for later. And that way you've got all your contacts in an email in the cloud that you can retrieve at some other point. And then identify a family contact for in and out of town. So this is somebody who all your family can check in with if you're separated during a disaster, or all of your chosen family can check in with if you're separated in a disaster. So that's a really good way to make sure everybody knows everybody's safe. It's also good to have a family contact that does not live in the town that you live in. so that all of your friends and chosen family or family can call that friend and know that everybody's safe. And then in the corner here, I've included the safety check, a logo from Facebook. There are other services like this. The Red Cross runs a Safe and Well program. This is also a really good way of just declaring to everybody that you love, I'm safe, I'm okay, this disaster happened in my neighborhood, but I'm safe. And some of you may have already used Facebook Safety Check before, where if you are in a disaster zone, Facebook actually will send you a notification saying, do you want to tell people you're safe? And you can click on it and post it to your Facebook. It's a really good way of just keeping everybody else kind of reassured that you're safe. Really good thing to do in a disaster. And then pets. Where can you evacuate with your pet? Do you have an alternate safe location for your pet? You should have a disaster kit for your pet. We'll talk about kits in a little while. Make sure your pet has proper identification, their licenses, if you need a license for them, identification of who they are, the adoption papers for your pet potentially. Make copies of the vaccination record for your pet. Make sure that your vet's contact information is some of those important numbers that you've saved so that you know how to get hold of your vet if you need to. And keep a recent photo of you and your pet. And I included a recent photo of me and my pet, including his long tongue. Have a recent photo so that if you're separated from your pet for some reason, hopefully that won't be the case, but if you are, you can be reunited based on a photo of you and your pet. Many of us have most of the photos on our phone are us with our pets, so that shouldn't be too big a problem, but make sure you have one, maybe print it out in your disaster kit, make sure there's one on the cloud so you can access it from anywhere. So let's talk about LGBTQ considerations for your plan. So there are several things. So as I said, most things in a disaster plan are things everybody should do, whether you're LGBTQ plus or not. But there are some things that folks in our community should consider. So you should ensure that your partner is listed on your insurance, whether you're married to them or not, right? Make sure that you have the right recipients on your insurance, that you have the right coverage that covers everybody in your household, and ensure that your partner is listed on that. Ensure that your partner or your chosen family members are listed as your emergency contact at workplaces, schools, and medical providers, so that they know who to call, who they can talk to. It might even be something that you want to make sure that these places can share information with your designated person, whether that be your partner or a member in your chosen family. So make sure that somebody is designated as your emergency contact in those places. If you rely on online networks, a lot of people in the LGBTQ plus community rely on online networks, whether that be apps on your phone or whether that be websites with chat functions. A lot of people rely on online networks in the LGBT community for social connections. So think about how you would continue to connect with your important people if the internet was unavailable for a number of days. Like, how would you continue to do that? A lot of people whose primary social connections are online don't necessarily have the phone numbers of those people. Or maybe it's time to start exchanging those phone numbers so you can communicate with them even when online connections are down. And then share your plan with your friends. Make sure they have a plan. Make sure you're in their plan and they're in your plan. Like, share this concept. A lot of people in the LGBT community don't have a household in the traditional meaning of that word. So create that for yourself in your plan. Make sure that they include you in their plan too. We don't have to do disasters alone. We can do it as a friend group, as a chosen family. We can work through any disaster situation as a group, and that makes it much easier, much better, and much more successful. Let's talk a little bit here too about during a disaster, everybody is in crisis mode. The community is in crisis mode. And unfortunately, and I'm just going to call it out, but unfortunately, during times like that, the assumption of heteronormativity probably increases even more so than in non-disaster times. So just be aware of that. We may not like it, we may not appreciate it, But as a personal preparedness step, in order for us personally to be more prepared, we should make the assumption that heteronormativity will increase during a disaster. And how do we navigate that as LGBTQ plus folk during a disaster when we are expecting that? I don't mean that in a negative way. The vast majority of disaster responders are compassionate and understanding of the LGBT community. You should go to a disaster shelter. If you need to evacuate, you will be welcomed. And if you're not, there are ways to address it, which we'll get to later. But being personally prepared for these kind of situations will help you navigate uncertain, uncomfortable, and potentially hostile environments that you may encounter. So just take all of that into account when you're making your plan. What do I need to ensure to make sure that my particular orientation or my particular gender identity is honored as I enter these new spaces where maybe I'll need to come out again to new people in the middle of a very stressful situation. So know that including your plan, everything you would need to do to protect yourself and be prepared for that kind of situation. And then finally, be an advocate for the LGBT community, for others who are LGBTQ, people you might meet along the way in a disaster shelter or at a disaster meeting. Stick together, help each other out, advocate for each other. We can do this as a community together. So building a kit. I'm not going to go into this too much in detail. There are lots of websites that list things that you should have in your kit. I encourage you to visit them. We'll have the links at the end. But know that having a disaster kit is an important element of being prepared for a disaster. So there are two different kinds of kits. This kit here that we're going to first talk about is the larger kit that you have in your house. This is what happens if something happens in my community, but my house isn't impacted. So I can stay in my house. I may not have electricity. I may not have internet, but I can stay in my house for the most part. There are caveats to that. If you don't have electricity, you might, and it's winter, for instance, you might need to evacuate. But this is a larger kit that you can kind of keep in the back of your closet, and it should have food and all these things that are listed here, in addition to some other things. This is just the start of the list. Again, it's whatever you think you need in your kit. In addition to some kind of basic items, you may decide you need other things. So know that this is the kind of larger disaster kit that you keep in your house. This is not intended for you necessarily to load in your car and evacuate with, although if you have the time, it's not a terrible idea. But this is really for your household. And then there's a go kit, this kind of concept of a bag you can grab quickly, run out the door, and it has everything you need for a couple of days away from your house, maybe going to a disaster shelter or a friend's house where you can stay. So this is the things you need to really go quickly. This can also be a part of the larger kit, but it should be in a portable format that you can easily run with. And then some other things that you should have in terms of healthcare things. You should have a first aid kit. You should have over-the-counter medications and prescription medications if you have any prescriptions. You should keep a list of all your medications, dosages, and your pharmacy contacts, and include your medical and health insurance provider contacts too in your kit. So again, some of this can be uploaded to the cloud. For those of us who have medications, prescriptions that change fairly frequently, you'll have to keep that updated if you're keeping it in the cloud. It's also important to note here that some people remove their medications from the original bottle and put them in like a pill container or something like that. The information on the pill bottle is actually really important in a disaster. If you're separated from it, you need the pharmacy information, the dosage information, the prescription information that's on the actual label. So if you do separate it, just keep that in mind and make sure that you have the information that's on the bottle safely connected to your kit at some level. And then some LGBT considerations. Include documentation in your kit of your family relationship, any adoptions that you may have, your relationship status, whether you're married or not. Include that in your kit so that you can, if you need to, prove the family relationship. Consider chosen family members in the development of your kit. We've talked about this before. You could have a kit making martini party for all I care. Like, have a party where you all make a kit together one night, make it a social event, make it something that you can have fun doing, but also you're going to be more prepared. I'm not necessarily saying you should put a martini in your kit, although I'm also not saying that. Just don't self-medicate during a disaster. And then for transgender people, some considerations in your kit. You may need to include specific grooming supplies for your situation, cosmetics, razors, etc. You may need to include binding or packing supplies that you need in your kit. Essential medications, hormone therapy, for instance. You don't want to have any break in that medication routine, so make sure you have essential medications and the information you need for those medications. And then finally, one of the challenges with transgender people in disaster is that many transgender individuals don't have identification that matches their gender identity, and that can sometimes cause some challenges when applying for disaster assistance or entering a disaster shelter. It shouldn't, but it can sometimes. So again, in the interest of preparedness, make sure that you have, if you don't have identification that matches your gender identity, make sure you have some letter from some medical provider that states your gender identity so that you can use that if you need to. You shouldn't need to, but it's good to be prepared just in case you might need it. And this is just a reminder, this is a map of the US of states that allow how easy it is to change your gender identity on your gender on your driving license. So the dark green states are the states that make it the easiest. You just can designate. Those states with stars allow you to put an X as your gender, a non-binary designation. As the colors get lighter, it becomes more and more challenging to change your gender on your driving license in those states. Some states make it incredibly difficult to change your gender on your license. So no, we're talking to Maryland and DC folk here mostly. Maryland and DC are in that dark color category. So, but know that you could be traveling and be in a disaster. You could be somewhere else. You could have relatives in another state. So know that it varies from state to state as to how easy it is to change your gender on your driver's license. And then maintaining your kit and your plan. So you should check your items in your kit every 3 months or so. You should change out any expired items that you have in your kit. So check the expiration dates. And ensure everyone in your household knows where your kit is kept, and maybe even your neighbors and your friends, right? Know where it is, so they also could grab it if for some reason you're sending them to go grab it instead of you returning home. Everybody knows where it is. It's not, disaster kits can sometimes be stored in like back of the closet, basement, kind of somewhere that isn't necessarily obvious to everybody. So everybody should know where your kit is kept. And then maintaining your plan, you should talk about your plan to your family, your chosen family, your neighbors, your friends, to anybody you can. You should practice your plan, practice your evacuation routes, practice calling the people on your contact list, make sure those numbers are still valid so that those essential numbers are still current. Make sure your registration with those alert services is up to date. So make sure you should practice your plan every 3 months or so. And keep your information updated. So during and after a disaster, we're going to talk briefly about this, and then we'll take some questions. So this is some legal speak here, but this is the 1988 Stafford Act. This is the act, the Federal Disaster Act, that kind of dictates what FEMA does during a disaster. So this is federal, this isn't state, but this is the federal act that talks about disaster assistance. And in this act, they define what a family is, what a household is. And you'll notice that there is nothing in this definition that says that there's heteronormativity here, right? So this can be any kind of household makeup. So there's nothing here that says it has to be a mother, a father, and 2 children and a Labrador, right? There's no traditional definition of a family here in the Federal Disaster Act here, right? So know that from a federal government standpoint, there's no limitation of what defines a household. However, there is often an assumption of heteronormativity, and heteronormativity is just assuming the world is always seen through straight eyes, right? So know that there's no heteronormativity assumption in the actual act. However, in reality on the ground, we might often see that. So before and during and after a disaster, here are some things that you can do as a LGBTQ community member. Be an ally to others in the community. Find each other, support each other, and advocate for each other, right? There's nothing better than kind of strength in numbers, supporting each other. Support local LGBTQ plus organizations and businesses. So after Hurricane Katrina impacted New Orleans, 4 of the 7 New Orleans LGBTQ plus organizations closed and never reopened. They've still not reopened to this day. So if we want our LGBTQ community to be vibrant and active and important, we need to support those organizations during and after a disaster so that their vitality remains even after a disaster, and they're there to support the community. So that's something we can do, a positive thing we can do after a disaster. A couple of numbers here, and these will be repeated and they'll be sent to you in the fact sheets that get sent to you after this presentation. The FEMA hotline is where you start the process of FEMA assistance. And you can call and register the impact of the disaster to you even before it's presidentially declared as a FEMA eligible disaster. So you can just register that you have damage. So know that that number's there. The Disaster Distress Helpline. This is a national helpline that is set up by the Health and Human Services Administration. It's actually run by a friend of mine who is a gay man. So they're very, very aware of LGBTQ issues. All their staff on the helpline are culturally competent and trained in LGBTQ issues. It's a really good place. Disasters are stressful, and it's good to recognize your mental health and recognize that you might need support for that. And this number is a good first step to getting that help if you need help. There's nothing wrong with that. And then a couple of other things, and these numbers are also in the fact sheet that will be shared with you. As I said, most disaster responders are very compassionate and understanding, but you may experience some discrimination. And if you do, the FEMA Office of Equal Rights, you can file a report with them and they will continue to follow up with it. That office is accessed through the FEMA hotline that's above. So this is the one number to access FEMA during a disaster. And just say that you want the Office of Equal Rights and you want to file a complaint of discrimination. And then there are a number of LGBTQ organizations. I've listed one here that's kind of prominent in disaster legal issues, Lambda Legal. That also may be a good place if you feel you've been discriminated against to get advice on what the next steps might be. And then get involved. I can't stress this enough. Like, in order to be that whole community disaster planning concept that FEMA introduced about a decade ago, you can get involved in your own community disaster planning and be a part of the solution in your own community. So I would recommend positively advocating for the LGBTQ plus community with your local emergency manager. Almost always local emergency managers want to be inclusive and want to help. And often they are required to be inclusive. And so they would welcome input from members of the LGBT community to advocate and say, just go step up and say, you know, if you ever need help, you know, with communicating with the LGBT community, I'm here to help however I can. So positively advocate for the community with your local emergency manager. Volunteer for a disaster response group like the American Red Cross, or your local CERT team, Community Emergency Response Team, or your local Medical Reserve Corps. Many communities have CERT teams or Medical Reserve Corps teams. Many communities have both of those. Volunteer for a disaster response group. I will recognize here that there's a lot of negative perceptions of the American Red Cross in the LGBTQ community because of the blood donation ban for gay men for many, many years. Know that that is not the position of the Red Cross. In fact, the Red Cross has actively campaigned to end that ban. So know that even though the Red Cross has a negative image in the LGBT community, that still may be a place where you will be welcomed in your local Red Cross. So that may be a place you want to try and see if that's a good fit for you. Participate in local emergency drills and exercises. There's nothing better than a local community having an emergency drill and having an LGBTQ representative being one of the actors in a disaster drill that can go through their process and point out where it maybe possibly wasn't as inclusive as it should be. Really good place for you to participate and give really constructive feedback on your local community disaster plan. A great example of this is you might participate in a shelter drill and you get to the registration form and it's not inclusive of gender identity or non-binary folk. So right there, your feedback is that form maybe, can we work on this form? I can help you work on this form. We can work on it together, right? Again, whole community planning. Encourage others to be prepared. Encourage your friends, your family, your household members, your chosen family. Encourage everybody to have their own plan and kit so that everybody in your community is prepared. And talk to your local LGBTQ community groups about their preparedness plans. How are they going to continue offering services to the community? What is their plan in a disaster to continue their services to the community? Okay, so we're getting to the resource section now, and then we'll go into questions for the last few minutes. So I did want to point out these two resources that we've already mentioned. These are the two fact sheets, one from last week's webinar and one from today's webinar. They will be up on the website soon, if not already, I think soon. Consider downloading these, spreading them, sharing them with your contacts. One is for emergency managers, responders, and community providers. So it's more about disaster planning from a community perspective. And then today's fact sheet is about personal preparedness for the LGBT community. And here is the fact sheet for today. So this is what you will see when you download it. It's just a back and front one pager. Really good to distribute to your network to make sure that they're more prepared. And then here are some resources. We got the Maryland Department of Emergency Management. There's some great preparedness resources on there, including what you should include in your kit, what you should include in your plan. The Maryland Emergency Preparedness Network, the hosts of today's webinar. So obviously they have some great information on their website. The National Center for Transgender Equality has a really good resource on specifically on trans disaster preparedness, and some good pointers and tip points there. Really good resource there. And then general preparedness on the FEMA website, ready.gov, really easy website to remember. There's some really good tips on what you should include in your kit, what you should include in your plan, how to be informed. There are some good tips there too. So all of these websites are also on the fact sheet, should you need them. So we have about, let me check the time, we have about 7 minutes left. That's pretty good timing for a Q&A section. So I see there's some chat comments, but I am ready to take any questions you may have. I may not have the answers, but we will. I see. Thank you, Shah. Shah's put the fact sheet links in the chat box too for you guys to download them. You can either ask a question audibly or put it in the chat. Either way works for me. We also have the survey. Shah, are you going to put the survey in the chat too? Did you already do that?
Leighton, while we're waiting for some questions to come in, I just want to give folks a friendly reminder that if there were some terms, concepts that you heard Leighton talk about today, if those seemed a little bit unfamiliar, the odds are that he did a deep dive into those last week, and so it may be worth your while if you weren't able to participate in last week's webinar, but you'd like to build your understanding and knowledge base. Leighton, I think you really covered a lot of ground last week, and this week certainly piggybacks off of that. So I would encourage you to look into last week's presentation if some concepts and terms today seemed a little less familiar.
Yeah, thank you, Caitlin. There's also a link on the fact sheet, and maybe Shah can share this in the chat too, to the Human Rights Commission glossary of terms, which is a really kind of good, if you're unfamiliar, or you're, I think sometimes in the LGBT community, you're some people are a little afraid to use some terminology because they think it might be offensive or outdated, and that's a really good glossary that kind of goes through all the terms and what's appropriate and what isn't. And the link is on the fact sheet, and it's also on the Human Rights Commission website. If you just search LGBT glossary of terms, Human Rights Commission, you'll probably get to it quite easily. So.
Yes, I don't want to put any more things in the chat because I want to make sure that everybody gets the survey. But everyone that participated, you will get a copy of the link next week. Everything will come next week. You will get copies of the links for this training. You will get a copy of the PowerPoint presentation and a copy of the related fact sheet. And the fact sheets are really useful information. And again, you know, Leighton is sharing everybody's contact information. Additionally, I've been putting in the chat the updated, the most up-to-date fact sheet for the community, as well as the one for the providers as well. But again, you will get an email since you signed up and you were registered. Additionally, information will also be added to the website. So again, look for that early next week. Should you have any questions, feel free to send us an email. The email address, I gave it at the very beginning, but the email address is info@mdemergencyprepnetwork.org. And again, that's here on this page. And again, we thank you for joining us. And Leighton, thank you again.
Thank you. Thanks, Yolanda, Alicia, Jay Grad. Thank you.
Thanks, everyone. We appreciate the participation. Leighton, it's been wonderful. We're going to miss you.
I'm coming to Baltimore. I'll be there.
And thanks, everybody, for the participation. We appreciate you. Have a great day.
Thanks, everyone.
Bye-bye.